Well, good evening, everyone, and welcome to the Healthy Living series. This is a presentation of Dartmouth-Hitchcock Health. I'm so glad that you could all make it for this evening's presentation on the prevention of cardiovascular disease with our cardiologist, Dr. Merle Myerson, who is going to present in just a couple of moments. But first, I'd like to just go over a couple of housekeeping items. First of all, we will be using the Q&A function for question and answers. Dr. Myerson will be leaving some time at the end of the presentation to answer questions, but if you do have anything that kind of pops up as she goes along, she said to feel free to send those questions in. At the end of this presentation, you will also receive a survey. It's very quick, less than 3 minutes, and that helps us to plan our future presentations and health topics that you find interesting. We're always have open ears and to your ideas. And then finally, I just wanted to note that we will have other Healthy Living series in the next few months. Next month on March 29th, we are planning a Healthy Living series event on COVID-19 vaccines, what that means for you, your community, and your families. That should be a great panel discussion, and we hope you can join us. So stay tuned for information about that. And then we also have in April couple presentations on our pediatrics team in our southern region. So please stay tuned for that as well. But without any further ado, I'd like to turn it over to Dr. Myerson, who will now present on taking charge of your heart health. Dr. Myerson?
Yes. Hi, everyone. Thank you very much. So those of you who might know me, I'm a cardiologist here at Dartmouth-Hitchcock. I specialize in prevention of heart disease, and that includes all the risk factors. I also have a graduate degree in exercise physiology, so I do sports cardiology here at Dartmouth-Hitchcock, and also we have our lipid clinic and advanced hypertension clinic. So just some of who I am, which I just reviewed. And I always like to show pictures. So this is a master's athlete with a javelin. So the message I sent here is that, we can do it. So heart disease and stroke statistics. I have some things here with women as well, that cardiovascular disease is a leading cause of morbidity, meaning getting sick, and mortality. For women, it's most people think it's breast cancer, but actually it's heart disease that is the one that is really the big concern. So what are the risk factors? Well, and I'm going to talk about each one of these. So cholesterol and lipids, blood pressure, being overweight, smoking, diabetes, sedentary lifestyle, stress and depression, and age. So it varies for men and women. For women, we use 55, but it's really an estimate of the time when they go through menopause. Postmenopausal women are at increased risk. And then the family history of premature cardiovascular disease, meaning having a stroke or heart disease before age 55 in a first degree relative who's a man, or less than 65 in a woman. So let's start with lipids. And lipids are a fat-like substance in your bloodstream. It's in your cells and membranes. So the body actually needs some cholesterol. There's two major types. One is cholesterol, and that's the good cholesterol and the bad cholesterol. And another is triglycerides. So here's a picture of the cholesterol. Those yellow bubbles are the cholesterol inside. I don't know if you can see my pointer here, but that's a blow-up of an artery, a coronary artery, which brings blood to your heart muscles. The yellow circles there are the cholesterol, and they get to the inside, or the intima, or the endothelium of your blood cells, and they start to build up. That's in those red circles there. That's the plaque. So throughout this talk, I'm going to emphasize the numbers that you should know. What I do is I write them down and give them to my patients. I also tell them what their numbers should be. So for LDL cholesterol, and that's your bad cholesterol. It depends on how many risk factors you have. If you are at lower risk, at least under 130 and optimally less than 100. If you're high risk, meaning have diabetes or have had a mini stroke, I'd say under 100. Very high risk, meaning that you've had a heart attack already, or you have a heart attack and diabetes and many risk factors. Less than 70, and some newer guidelines are saying get that LDL down to less than 55. What test should you get? That's a fasting lipid panel. So let's go on to hypertension now. And Angelica, I just should say that in my screen now, I can't see if someone is asking a question. So I'm not sure if I can change that. But again, we're going to be stopping early to allow for questions. So hypertension, well, people say I can't feel my high blood pressure, so why should I care? Well, high blood pressure adds to the workload of your heart. Over time, it can damage your arteries and your heart muscle. It's also a leading risk factor for stroke, heart attack, and kidney disease. So I always tell my patients, think plumbing system. Think of the water running through your pipes at home. If it's under too high pressure, it can damage the pipes, which are like your arteries, or it could also burst your pipes. That's when you have something called an aneurysm that bursts. Now, there's two numbers to know, because remember, as I said, as we go through this, I'm going to be highlighting the numbers you should know. The top number is the systolic pressure, representing the pressure when the heart contracts and pushes the blood out of the heart and through the rest of your body, through the arteries, which bring the blood to the rest of your body. The bottom number is called diastolic, and that's when the heart's relaxing and filling with blood. Blood is coming back to the heart. But it's still important. So you have the top number and the bottom number. I've written here less than 120/80 is what we call optimal. Now, just to note, because it's higher, say that top number in the 130s, does not necessarily mean we rush out to start you on medications. We certainly want to focus on lifestyle, diet, weight loss, and exercise to help lower that. Also, some patients who are older might get lightheaded if their top number or bottom number is too low. So here's again what the normal are, and that area in between where we do emphasize lifestyle, and then hypertension, where we want to start thinking not only about lifestyle, but treating with medications. So what can you do to lower your blood pressure? Well, the first thing always is to have the things you can control, meaning weight, salt intake or sodium, too much alcohol, stress, and lack of exercise. Some of the things that are less easy to control, obviously, are your age, hereditary, and race. So we know that some racial and ethnic groups tend genetically to have higher blood pressure. Let's go on to overweight and obesity. So another number you should know is what's called your body mass index, or BMI. And it's calculated. I left the calculation there. And underneath this, I have listed what is ideal. Now, just another thing too is that this is a formula, but we're individuals. So certainly, for example, if someone is a full-figured woman, for example, their body mass index may not be what the charts say it should be, but you can still be healthy if you're active with a higher BMI than what is on the chart. So, everything has to be considered for individuals. Now, how should you lose weight? Well, if going on a diet is your thing, okay. But sometimes I say, meaning going on a diet means you can go off a diet. So how many people here have been on, off, on, off? So what I try to emphasize is finding an everyday heart healthy eating plan that you can maintain and has the right balance of calories and nutrition. So I refer some patients to our dietary counseling. Jean Copeland is the nutritionist who works with us, and she's really wonderful. She looks at how you're eating, why you're eating, and not just saying, eat this percent this and that percent that. Exercise and physical activity is an essential part of the energy equation because it's not only what you're putting in, that's calories, but what you're expending calories. For some, Weight Watchers is a good idea. They are a balance. They teach you how to eat. It's not for everyone, but certainly if people want to do it, I think it is a good program. All right, smoking cessation. Now, again, I don't think that I can see, let me just see if I can see hands here put up. I guess I can't, but how many people out there are smoking? Hopefully not many of you, or have a family member who smokes. So behavior change is one way, and I know it's a tough habit to break. My father smoked and quit once and went back. But changing the way you're thinking about smoking and contemplating smoking cessation, visualizing yourself as, Merle Myerson, the non-smoker, versus all the years of thinking yourself as the smoker. I also ask patients, think about why you'd stop smoking. You have grandchildren. Well, they want you to be around for their high school graduation. So some of those motivating factors. Now, many people benefit from pharmacologic therapy. The most common is what's called nicotine replacement therapy, which is patches, gum, lozenges. There are also medications that you can work with your provider or smoking cessation counselor. Now let's go on to sedentary lifestyle. So exercise, in my opinion, is medicine. We prescribe it and it does all good things. And, the nice thing is there's rarely a side effect from it. So let's check off what medicine characteristics exercise has. Lowers blood pressure, lowers cholesterol, weight reduction, increases your overall cardiovascular fitness, helps manage diabetes, or in some cases, if you're what's called pre-diabetic, it can help you from becoming diabetic. Reduces stress, sometimes releases endorphins, which can help relax you, and strengthens bones and muscles. Now, we, all have pretty busy lives, and sometimes it's hard to set aside that time for a regimented exercise program. So what I advise is on the days you don't work or on weekends, try to get that 30 minutes in of rapid walking, running, riding a bike. But you can increase your energy expenditure through physical activity in your daily life. So I know at Dartmouth-Hitchcock, I actually see people doing loops. There's one woman who has her cell phone, maybe she's listening to music, but she's making circles around part of the hospital. I try to take the stairs. I go from my office on the 5th floor down to the cafeteria and then walk up the steps again. At home, walk or bike to errands, rake leaves, garden or housework. Actually, I've been shoveling snow and counting that in my exercise. Office, walk at lunchtime. I said, take the stairs. If you travel, which obviously with COVID, we're not doing so much of, but stay at hotels that have a fitness center. Leisure time, plan family outings that involve activity or going dancing. I think that's very important now that we have COVID, where go outside and, socially distance, you're with your pod, you can go for a hike, even on snow trails with proper footing. So what is an exercise program? Well, the very most important thing is just get out there and do it. Do anything. If you're moving, that's great. But if you want to get a little more formalized, I'd say try 5 or more times a week. But if you can only commit to 3 times a week at 30 minutes, I'd rather have someone stick with a program than get all gung-ho for a couple weeks and then drop off to, back to not doing much. Duration, well, 30 minutes per session. But again, what you can give it, I think is most helpful. Intensity, you want to get your heart rate up. The way I do it, if you're saying, well, I'm going to do 30 minutes of walking 3 times a week, And, just thinking, oh, do I have to go this fast or that fast is too stressful. Whatever pace you do is good. But you will get a little more benefit if you get your heart rate up. Now, some people feel their pulse or do it on their wrist, but you can also use a talk test. Right now, I'm talking pretty what we call fluent, but if you're talking like this, it means your heart rate is probably up a little and you'll break out into a sweat. You want to use your major muscle groups, so your legs, arms for swimming, for example. You also want to include some strength and flexibility. So strength can be buying a set of weights, doing push-ups, sit-ups, things like that. So this is an exercise prescription. 58-year-old woman, she's active but no regular exercise. So once again, you can work by an exercise prescription. You don't have to. As I said, going out and just getting moving is good. But here it would be. So she wants to know what heart rate she should exercise at. So we actually give a range where we feel that they would be getting their heart rate up to where it would stress her cardiovascular system. And we take a formula, 220 minus the age, and then a percent of that, 2%, and give everybody a range. We want you to stretch before walking. She's going to do a walking program. Walk at 2 to 3 miles at 3 miles an hour, 5 days a week. A heart rate about 115 beats a minute. And strength, she can do modified sit-ups and toe raises. So there you go. That's what an exercise prescription is. But once again, develop what works for you. Time for another picture. This is again from a master's track race. And, I don't know how old these women are. They're certainly probably in their 50s, maybe higher. And they are really going at it. So, age is not a boundary. Okay, let's talk for a minute about stress. And what is stress? Well, it can impact on your cardiovascular health. It can do that directly or indirectly, because if you're stressed out, you're not going to be taking good care of yourself. So what is stress? It's your body's response to change. And it's an individual thing, because what one person may find stressful may not bother someone else. Not all of stress is bad. I think if everyone was very mellow the whole time and no kind of ups and downs, they might not be stimulated to make change or do other things. How do you treat stress? Well, behavior, again, is an important component. You can learn to avoid stressful situations or be better prepared when you can't avoid them. And you can change how you respond to stressful situations, saying, I know that coworker or my boss is going to, press the wrong buzzers, ring the wrong bells with me. So how you can avoid it, how you can say, I know it's going to happen. I'll count to 10. I'll try to leave the situation. But, if it's just getting the best of you, seek out a mental health professional if you have a hard time coping on your own, or if you have depression. All right, so now what I'd like to do is just talk about several items. So aspirin, it's an analgesic, anti-inflammatory. We used to give a lot of it for what's called primary prevention. Say, for example, a patient has several risk factors, but has never had a stroke or heart attack. So now we feel, though, we shouldn't just give it out so broadly, that there were risks of bleeding. So we still do use it to treat patients that have had heart attack or stroke. So the bottom line, if advised by their healthcare providers, take it, but always have that discussion, should I be one who should be on it? I'm going to talk about menopause and hormone therapy as well. So many of the listeners, as I said, I can't see who's actually listening, but if you're postmenopausal in a woman, years ago, we had studies that said, everyone should go on hormone replacement therapy, on estrogen. But many studies came out and found maybe not. The studies, though, were faulted for beginning the study many years after menopause, and they didn't consider that some women really have symptoms that are very bothersome. So more studies have come out, and this was at Women's Health Initiative. And as I said, it was criticized for many reasons. So what to do? So first of all, it's an individual decision between a woman and her healthcare providers. We now have different formulations of hormone therapy. We also directed at the years right at the time of menopause and say use the lowest dose for the shortest possible time. So again, a good conversation to have with your healthcare provider. So, in sum, what I'm going to say is cardiovascular disease, again, is a leading cause of morbidity and mortality. Know your risk factors, know your numbers. And again, another picture here. So this picture I love as well. So this is the men this time. They're going for a track race. And, I'm sure that they are well into their 50s or 60s or more, but they are going for it. So this is also how I end my talks. We will not go quietly. We will go red. And I'd like to open it up for questions as well. So let me see if I can change this so I can let's see how I can do this here. Spotlight for everyone. Okay. Angelica, I don't know if you can help me to go back to the view for all.
Sure. If you want to just stop sharing your screen.
Okay. So
we don't. If you have questions, please feel free to submit those through
Got
the
it. There we go.
There
Okay.
Go.
All right. So so I know I covered a lot of territory here, a lot of issues, but I'm open to questions that you have. I know that you can access my slide set as well.
Mm-hmm. Yeah. A couple of questions that did come in is how can you lower your triglyceride levels?
Right. Yeah. So no, usually I've given these live, with COVID, we can't. And I ask for questions as we go along. So a little bit of a different year because we're going virtual. So triglycerides, again, are a form of fat that when they're in too high levels can increase the risk for heart disease. Also, if they're very high, meaning over 1,000 milligrams per deciliter, can cause something called pancreatitis. So when triglycerides are mildly elevated, that's about over 150, we really like to start with lifestyle. And triglycerides are very responsible to diet, meaning things that you eat. And to get a list of these, you can go to what's called the National Lipid Association website. They have patient tear sheets, and they're very good at listing the foods in particular that raise triglycerides. The other thing is that extra body weight, especially around your midsection, called abdominal obesity, is felt to be different. Those fat cells or adipose cells churn out triglycerides more so than other areas in your body. So losing weight, especially abdominal weight, can be very helpful. Medicines can also help, but everyone really should try with lifestyle, and oftentimes that can bring you to or near goal. Okay, next question.
Yeah, we have another question. Again, please feel free to keep those questions coming in. We have that Q&A box, so please feel free. This one's an interesting one. I've actually wondered this myself about the keto diet and cardiac health. I feel like we hear a lot of conflicting things about the keto diet, and is it good for your heart or not?
Right. So ketogenic diet, there's also the paleo diet. So they can be good in the short term. Sometimes people go on the keto diet to lose weight rapidly. What I like to say is everything in moderation. And so certainly if you have diabetes, your diet is going to be guided by the nutritionist or diabetes educator. But the Mediterranean diet is something that I like. So the Mediterranean diet, and you can look this up as well, is a way of eating, and it is not necessarily eat this, don't eat that. So it focuses on fruit and vegetables, whole grains. Protein would come from fish and chicken. And also it's lower fat. Nuts, for example, are very good. Nuts can have a lot of calories, but the oil and fat in them is healthy. So for calories, I always say a handful, not a canful. The other diet that I recommend is called the DASH diet, DASH. And again, it's just a way of eating, choosing certain food groups. It's particularly helpful to lower blood pressure. You can go online and get the capital DASH diet. So again, moderation. Some people enjoy their red meat. Venison is a very low fat meat. I think the thing is to have that less often than you would, for example, grilled fish, or if you're a vegetarian, you'd be eating things, vegetables, tofu. So for meats, if you do eat them, certainly that slab of a steak, well marbled, is something to rarely have. I choose low fat cuts of meat. I make my own meat sauce by buying 93% lean chopped meat, and I drain off the fat and make my own sauce. So, sometimes people want to incorporate sources of protein in their diet. Again, favor the chicken without the skin, grill it. Fish, when you grill it as well, grilled, baked, or broiled. Okay, next question.
Great. Yeah, we're getting some good questions coming in. But can we just start with, could you repeat I'm sorry, I'm not sure if I'm getting this right, the National Lipid
sure.
site?
This is a great website to go to. It's called the National Lipid Association. And if you put that in your browser, it's called NLA, National Lipid Association. Go to their website. They have great patient tear sheets and other information.
Great. I'm going to type that into the chat box, National Lipid Association. And then somebody asked, how much salt should we have each day for optimal heart health?
So that's a good question. Now, the reason why I don't know that number off the top of my head, I think it might be 1,500 milligrams, is the reason why I don't tell people how many milligrams. Because number one, if I can't remember, I don't know how many others can. Number two, how are you supposed to go about your day adding up milligrams? So you can actually go online, record all your food and how many milligrams. There are websites, how many milligrams in your bagel, something like that. But so what I tell patients to do is to look at labels. And if there's no label, you can put it into your computer, how much sodium in one serving of this. So if the side of the can or jar says one serving has 30% of your daily sodium, that's going to be a high salt content food. So you'd want to avoid it. Then also avoiding certain groups of food. For example, processed foods have more sodium. When try to make things at home where you can control the sodium. Don't add sodium when you're cooking pasta. Sparse use of the salt shaker. Certainly when you're baking, you really need to add it in, but look for low sodium recipes. Other things that have a lot of sodium are pickles, relish, some condiments. I tend to try to use flavorings like lemon juice, garlic, herbs. So that kind of gives me a lot of flavoring without the salt and sodium. So I think it's just watching what you eat, looking at labels, trying to make your own foods, trying not to get highly processed foods as well.
Thank you. Thanks for those questions. And again, please, if you have any questions, please keep them coming. Somebody asks, Tia asks, how concerned should we be about a slightly elevated diastolic BP if the systolic is normal?
Right. So the diastolic blood pressure, again, is when the heart's relaxing and filling with blood. two things. Sometimes it's a little harder to get that accurate when you get blood pressure measured. We do want it less than 80. Up to 90 is still considered a borderline reading. So also, you should take multiple readings. Sometimes it is higher when you go to the doctor. So that would mean getting a home monitor to measure it at home. But both the elevated systolic and diastolic are important. So, certainly we do focus on the systolic for several reasons. First of all, it tends to be a little more accurate if you've ever done your blood pressure or listened for it. Sometimes listening for that second sound, it's a little bit off. But in some, both numbers are important. Generally, we don't see so much isolated diastolic or bottom number elevation. Okay.
Yeah. Thank you. Somebody wants to hear kind of some of your success stories with patients. Like, have you had patients that you've seen come in and make dramatic changes to their health? And
yes. Yeah. So here's a really nice story. So back when I worked in New York City, I actually worked in a clinic. It was patients who didn't have good resources. Some of them actually lived in shelters. And I would still say, this is how you should eat. Now, many of the patients didn't have as many choices. Many didn't have a kitchen. But one patient came back to see me and her blood pressure was much better. So I said, gosh, how'd you do that? So she looked at me kind of strange and said, because you told me to eat skim milk rather than regular milk. So I had to laugh at myself. Well, of course I told them, and anyone can make changes. So even with few resources and less choices for food, she had sought out where she could select or choose skim milk over regular milk. And the good thing is, too many of the places where food is given to people, Meals on Wheels, foods, soup kitchens, things like that, are now giving the people who come some good choices. So that one I distinctly remember. And the message is, anyone can make changes. And again, whether you go on a strict diet or not, it's about choices you make. And also, I feel that, it's the majority of rule, if you, just say, I just miss my ice cream. Well, have it once a week, instead of having it every day. So that, I think, stands out in my mind as a really nice story. I certainly have many more who have quit smoking. And another one is, in my previous hospital I was in, worked out of Cooperstown, New York, and I had one patient who already had cardiovascular disease. And we were talking, and I always like to hear stories of how people quit. So he was, I think, a pack-a-day smoker, and he used to have his cigarettes in his pocket, chest pocket. And he told me one day, I said, he looked down at his pocket and he said, "You're not going to win. I'm going to win. And I'm not going to smoke." And he never smoked again. So everyone's an individual, what their willpower is, what their stress is in life, what their supports are. But he said, "You're not going to win." So that's another really nice story.
That's great. Awesome. So someone asked, Barb actually asks, how much exercise for someone who's about 80 years old? Is there like a good rule of thumb for that?
Right. So I feel everyone can be active, and it depends on, what's going on. Many people, especially older people, are limited by arthritis or knee problem. Some may want to exercise, but are deconditioned or have been sedentary, overweight. So a couple of suggestions. Sometimes working with a physical therapist to help you design a program, especially if you have bad knees. Might be riding a stationary bike, because remember, your weight is supported and you can adjust the tension to help not put pressure on your knees. There's also ways to exercise in a chair. If you're watching TV, buy some hand weights or get 2 cans of food and you want to do back and forth. or lifting your legs. So, I'd say talk with your provider, seek out an exercise trainer to help you design the program or a physical therapist. Start slow and build up. So, anyone can be active, whether it's sitting in a chair, taking a walk, working out with exercise bands or light weights, doing a video on television where you're marching in place. So, I think that sitting down and speaking with providers that you have, with nurses that work with you, and asking what resources you can have to help you start a program.
Thanks. Yeah, we're getting some great questions.
Yeah.
Alice is asking that she recently became a vegan, and her last set of blood work put her right on the edge of needing statins. So is the vegan lifestyle good for her heart health?
Yeah, so vegan lifestyles can lower, because generally you don't really have animal sources of protein, so you do lower your cholesterol. So some people genetically might still have high cholesterol, but the vegan diet or, any heart healthy diet is going to help hopefully bring you to normal or reduce the amount of medicine that you need. So it would depend, Alice, on your risk profile. We can also do some other testing to see if you might have what's called subclinical atherosclerosis. One of those is called a coronary calcium scan. So yes, you still, being vegan, you still may need cholesterol medicine, but hopefully from your diet, it's a lower dose than what you would have needed. Now, depending on what your other risk factors are, you may or may not absolutely require a statin drug. And there are some medications that are called non-statins. Now, just to note, while a vegan diet may work for you, it can be tough to maintain, tough to get good sources of protein. So, it may not be for everyone, but, if it works for you and it's helping, then that sounds very good. Okay, we have time for a couple more questions.
Yeah, we have a great question. This is from Carrie, and she says, I'm only 100 pounds, exercise often and eat very healthy, yet I'm already pre-diabetic at 50. Mm-hmm. My mom was diabetic at 40 and had her first heart attack at 60 and passed away at 69. I'm so sorry.
Yeah.
Her 5 siblings died in their 40s and 50s. Am I doomed because of my family history?
All right. Well, I think, first of all, I'm sorry to hear that as well. And I don't know if family members were also smokers too. I think it would be helpful for you to perhaps see a cardiologist, one that has familiarity in lipids and prevention, whether to do some testing given that family history, because, that's quite a bit. And certainly would want to leave no stone unturned in finding out what your risk is. So, whether a stress test would be in order or some other testing, certainly, hard to know just what happened with your family members. There can be things unrelated to what's called atherosclerosis that cause early and premature sudden cardiac death. For example, a heart rhythm abnormality. So I think in your case, you really do want to make an appointment with a cardiologist to review that. If you don't know one, ask your primary care provider to refer you.
We have one more question. Sorry, my dog, I think there's somebody at the door. So the
okay, that's fine. We like dogs barking.
So Kathleen would like to know, is there somewhere where I can learn about the pancreas condition you discussed earlier?
Sure.
Also, are there more accurate at-home monitors for monitoring?
Right. So first, with triglycerides, you can, and pancreatitis, you can try the National Lipid Association. Another website that I like is the Mayo Clinic, MAYO. I find that they have a very good website to ask for, and you enter in what condition you want to learn about. Now, for home monitors, what I do is tell people to go into their drugstore speak with a pharmacist, because it may be he or she who helps ordering those blood pressure monitors and can let you know which ones in their experience seem to be good or which ones have not been brought back or broken. I also say you don't want the wrist one. You want one that goes on your arm. Also, you don't have to buy the most expensive, but I wouldn't buy a cheap one. So that's my advice, to go in and say, you like to buy one of the home monitors. Which one or ones do they recommend?
Great, thank you. And then we have one more question. Again, we have probably time to answer a couple more, but
I tell you, let's take one more, and
okay.
Certainly if there are others, we can have someone write in, and I'd be glad to do that. Yeah,
Absolutely.
I just have got home late because of the snow, and have a little shoveling to do to get out.
Oh gosh.
Yeah.
Yeah. So we'll take one more question, and then just a reminder: if you do the survey at the end of the session, you can also submit any questions through that survey, and I will definitely pass it on to Dr. Myerson, and she can take a look at those.
Absolutely.
Yeah. So our last question, and we may have gone over this, but how do statins work to lower cholesterol?
Right. So statins statins are metabolized in the liver. So there's a number of what's called enzymes and different chemical steps to actually make the statin. And the statin interrupts one of those steps. So statins are also known as HMG-CoAs reductase inhibitor, because they inhibit an enzyme that is used for your liver to make statins. Now, so that's one way that we prevent higher levels of statins. They work for many people. Some of the other ones, one called ezetimibe, the trade name is Zetia, is what's called an intestine absorption inhibitor, meaning that it prevents your body or your intestine from absorbing some cholesterol. So those are the statins are the main medicines we use. The reason that they are so good in standard of care is years of research have shown that overall they're really pretty safe. The benefits far outweigh any risks. And also they do other things, and it's called the non-LDL lowering benefits. That includes, they have some anti-inflammatory properties. They also make the inside of the artery, the endothelium, healthier. So, statins are a good medication. Yep, many people do have what's called muscle soreness with them. But, I can work with patients to help them adapt to some of the statins, change from one to another, have the doses arranged differently to try to work with patients to get them on a good statin. But, we now fortunately have newer medications that are non-statins. So this would be something that you discuss with your healthcare provider or be referred to a lipid specialist.
That's great. Thank you so much, Dr. Myerson, for joining us today.
Sure.
Appreciate your time and expertise.
Sure. If you have other questions, I know that it's about 10 of, quarter of, but certainly I'd be glad to do that and maybe come back and have a part 2 at some point. I can look at all the questions and see what people want and develop another program answering some of those. So
absolutely.
Thank you for having me.
Yes.
I really enjoyed it. And I think just by being here, all of you are taking a great step to your cardiovascular health.
Absolutely. Right. Yes. Thank you, everyone, for joining us. Please.
Yes. Thank you very much. Have a good night. Stay safe in the snow and drive carefully.
Thank you.
All right. Take care now. Bye-bye.
Bye.